each year there are 1.4 million emergency department visits among patients with dementia, and this represents about 7% of all emergency department visits for patients over the age of 65. The top two reasons are accidents and behavioral and mental health symptoms. These types of symptoms can include things like agitation or aggression, things like hitting or kicking, unrelenting anxiety, or what we call psychosis, which can include things like distressing hallucinations or paranoia. We found that patients with dementia who are in the emergency department are twice as likely to receive antipsychotic or sedative medications. And that can be concerning because these medications are associated with a high risk of side effects. They can lead to falls, which then can lead to future emergency department visits if they're continued. We also know that the emergency department can be a very distressing experience for a patient with dementia, and sometimes just the disorienting and overwhelming experience can lead to increase of these behaviors. And one of the challenges with dementia is that often as the disease progresses, it can be very difficult for a person with dementia to be able to communicate their needs or explain what they're experiencing. So it really can take a trial and error approach to try to figure out what these types of behaviors are representing and identify potential triggers for behaviors. Caregivers of persons living with dementia, we know that this can be a very challenging experience, and caregivers are often drafted, not recruited. I first recommend checking with your primary care doctor's office. There might be social workers or nurses there who are very knowledgeable about the local resources. I often guide my patients and families to the Alzheimer's Association, which has wonderful caregiver training resources, as well as support groups and 24/7 hotlines to help caregivers who might be struggling managing these behaviors at home.